It's very interesting when you talk to parents. I feel like there are three distinct camps. There's the one camp who cannot wait to get their children vaccinated, and they're asking me, when is it going to be available under the age of 12? I'm going to sign up the minute my child is eligible. Then there's the next camp that's a little bit more hesitant. They're thinking, well, and what they're doing is a really logical calculation. They're weighing the risks and the benefits. They're saying, well, COVID in general is less severe in kids, and that is true overall. And they're saying, what's the risk of getting the vaccine versus, would it be so bad if my, child came down with COVID? And they're trying to do that risk benefit analysis. And I think for that sort of hesitant but not refusing camp, I think that FDA approval will be of some comfort to them. I think that it will kind of tie that nice bow around the process and get them to feel more comfortable with that. And then there's the third camp that is just, no way, no how is this going to happen. And so, I think that those are the kinds of conversations that I have. And the most challenging conversations really are those, those folks that, there's just no getting through. And my heart breaks for what happens to some of these kids who aren't vaccinated and do end up getting sick. And it's really heartbreaking as a pediatrician because that there was something that could have been done. And I think that's really what me and my colleagues really struggle with, is those kids that were eligible to be vaccinated chose not to, or their parents chose not to, and then they ended up getting really sick. And those really weigh on us as healthcare providers.